This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, so a study of awareness while paralyzed for mechanical ventilation in the emergency department. Like I said, it gets studied in the operating room, and they have found in the operating room that there's certain risk factors for being awake and paralyzed, something that nobody wants. Those things include just getting IV medications and not inhaled medications. You know, in the OR, they give them gas. That helps prevent people from being awake. Long-acting paralytics, not having like a formalized monitoring system for awakeness. Those things can make people at risk for being awake and aware, and those are things that definitely happen in the emergency department. So there haven't been a lot of studies that looked at this. This was a study that looked at one center. They kind of went back at their patients who had been intubated and paralyzed in the emergency department, and after they survived and were back to normal, sent them questionnaires. And they found that out of 380 patients they looked at, 10 could remember very clearly being paralyzed but aware. And that's 2.6%, which, over time, it seems like a lot of patients that could have this. One of the things that made patients in the emergency department in this study at risk for it was getting Rocuronium. Rocuronium lasts longer than we think. A lot of times we give people an initial dose of etomidate or ketamine and Rocuronium, and then they're paralyzed for potentially 40 minutes or so, and we don't think about giving them more sedation. So when we have patients who we give Roc to, we should be extra aware of giving them extra sedation, and even patients that we give Sux to, just being on the heavier side of sedation for patients that are paralyzed. It's not something I think any of us would want to be, paralyzed in the emergency department, being ventilated, procedures done, and being aware of it. So kind of an interesting thing to think about when we have patients that we intubate. Any questions? All right, thank you.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.